Once the area is sterile, place the footprint sizer behind the ear. The best position for the coil section of the implant is posterior and superior to the ear canal, angled at approximately 45 degrees. Mark the correct position of the implant on the skin around the rim of the footprint sizer. Mark the incision at least 5 mm away from the desired implant position to minimize the risk of device extrusion. Create an incision behind the pinna. Preparing the periosteal pocket. Using the footprint, prepare a tied periosteal pocket to accommodate the coil section of the BCI 602. Check the size and position of the periosteal pocket with a footprint sizer. For proper signal transmission and fixation of the audio processor, the flap must not exceed a thickness of 7 mm. Evaluate the thickness of the flap over the coil section, for example, by using the skin flap gauge 7. Creating the bone bed. The BCFMT is the only part of the implant which needs a bone bed. To recess the whole BCFMT, a drilling depth of 4.5 mm is required. The two standard screws delivered with the implant are 5 mm in length and 1.6 mm in diameter. When fixing the implant, they won't penetrate the bone deeper than the transducer of the implant. Attach the handle to the transducer sizer and use it to mark the position of the BCFMT on the skull. Drilling is performed with standard autologic burrs. While drilling, use the transducer sizer together with the handle to check whether sufficient bone has been removed. When the transducer sizer can be placed fully into the bone bed, the drilling is sufficient. Once the required depth has been drilled, check whether the screw wings are in flat contact with bone. This is done by connecting the transducer sizer to the footprint sizer and handle. For easy handling, the entire tool can be held like this. A surgical needle is used to check flat contact to the bone. Fixation of the BCI 602. Remove the implant from its sterile package and place it in the surgical field. If BCI 602 lifts are being used, attach them to the implant now by pushing them onto the fixation wings. For optimal coil positioning, the implant can be bent at its transition. In a horizontal plane, it is possible to bend it plus or minus 90 degrees, and in a vertical plane, minus 30 degrees. First, insert the coil section of the implant under the skin and place the BCFMT in the prepared bone bed. Use the two self-drilling cortical screws and the single-use surgical screwdriver to fix the BCFMT to the skull bone. Initially, tighten both screws loosely. Then fully countersink them to properly secure the implant. Closure. Before closing the wound in layers, palpate the BCFMT to ensure it is fixed properly. Then, close the wound and apply a wound dressing.